Your journey is truly uniquely yours. And the emotional weight of infertility can really be overwhelming, and it's okay to feel a mix of emotions. Sadness, frustration, anger, moments of hope, moments where you just want to laugh or cry or both.
And both. Whenever people ask me, who are you most inspired by? I always say my patients, because really, our patients are the bravest, most courageous people I know. Hi, superhumans. I'm Dr. Mavis Garcia.
And I'm Dr. Wise.
We're two of the physician leaders at Mark and Fertility Center, otherwise known as Our Baby, MFC.
As fertility specialists, we've witnessed firsthand the challenges, triumphs, and the myriad of emotions that come with trying to conceive. Whether you're just starting to think about having a baby, actively trying, or facing challenges along the way, My Fertility Podcast will be your go-to resource for honest conversations and a supportive community.
So grab a cup of coffee or tea and settle in, and let's demystify the world of fertility together. It's our first episode. I can't believe it. Am I dreaming?
We're definitely here at our very first episode. This is real. I'll pinch you.
We're excited and we're anxious as well, because we want to make sure this is as amazing as we have imagined it for a long time now, and that it provides incredible value to our fertility community.
And we're nervous because we've never done this before.
True. We have so much we want to share and thought long and hard about what our first episode should be about. Then we decided, why don't we answer the most common question that we get asked in our fertility practice, which is,
why am I not pregnant?
That's right. That is the big question we get asked all the time, and it's not easily answered. The answer really varies for every single person and in so many different cases. But we still felt that we should talk about it and tackle, how do we approach this question in our practice?
And oftentimes the question's not even really that answerable too, which we'll get into as well.
That's right. And sometimes the why, it's not the most important part either.
I don't think it ever is.
It really isn't. Just because we don't know exactly why you're not pregnant, it doesn't mean we cannot help you get to your ultimate objective, which is to get pregnant. So let's get into it.
So before we delve into infertility, I think it's really important to think about fertility in general. You know, there are so many specific things that have to come together at the right time for a pregnancy to actually occur.
That's right. The biggest predictor of a spontaneous pregnancy, so let's say a person with ovaries in a heterosexual relationship, the biggest predictor of whether or not they will get pregnant is age. And I know people don't like to hear this. I certainly don't like to hear this either, because I am a big feminist and I like for women to go and accomplish their dreams and not be pressure into having to start a family too soon. But unfortunately, that is the reality of biology. Age is the most important predictor of spontaneous conception in heterosexual relationships. So when a woman is around age 25, the chances of conceiving each month is about 25%. So it is normal for a pregnancy to take a few months, even in a young reproductive age.
Once a woman gets into her early 30s, the chance of pregnancy each month drops a little bit to about 20%. By the time a woman will hit 40, that chance of pregnancy each month drops to about 5%.
So when is it time to worry? When is it time to see a fertility specialist? When is it time to start worrying about the ovulation predictor kits and things like that? Well, in women under 35 years of age, we normally say that after 1 year of unprotected intercourse, pregnancy really should have happened. It usually happens in about 85% of couples after a year. So if it hasn't happened to you, then it's definitely time to see a fertility specialist.
In women who are 35 and over, it's better to get checked out sooner because the clock is ticking, unfortunately. And so after about 6 months of trying, it's a great time to seek out fertility help. Now, if there are some clues that somebody may have difficulty conceiving, like, previous fertility problems, endometriosis, somebody who's got irregular menstrual cycles or PCOS, let's say it's a person with sperm, they're taking testosterone or other kind of medications or problems having intercourse, those are all reasons to definitely seek out fertility care sooner than that 1 year. And there's so many more reasons out there. I didn't list them all off.
Absolutely, especially the irregular cycles. I see that a lot. I would hate for women who are having a period like once every 4 months to wait a whole year to see us. They should actually be seeing us right away, regardless of how old they are.
Absolutely, for sure. That year is not rule. It's not a law.
That's right. So if you are struggling with infertility, know that you're not alone. Actually, it affects about 15% of couples. And according to the Canadian Fertility and Andrology Society, infertility affects about 1 in 6. So think about it. If you're at Starbucks and there's about 10 people there, I bet you that at least 4 of them will have experienced infertility.
Another really big question that I get asked a lot, are infertility rates rising worldwide? And this is a really complicated question, actually. And I think the answer is maybe. There are so many variables to consider when we're thinking about this question. For instance, in general, people are older when they're starting, like actually trying to conceive now than they were, let's say 15, 20 years ago. We know that affects fertility. There's also some thoughts that, higher average BMI, our diet, our lifestyle factors may also play a role. To be honest, I think that people are also just much more forthcoming and honest about their fertility journeys than ever before. And so we're hearing a lot more about it just because people are being more open and honest about it as well.
And that's definitely a good thing because there's usually a lot of shame and a lot of stigma associated with infertility. And it's wonderful that there are so many people coming forward, sharing the stories, letting everybody know it's not their fault and it can happen to everyone. We've seen so many celebrities now talking about it, like Jennifer Aniston. And that's great because it shows that even when you have a lot of money and a lot of resources, infertility really affects people in all areas of society.
Yeah, it's a really, really good point.
And specifically for female physicians, actually the rate of infertility is 1 in 4. The general population is 1 in 6.
Yeah.
So people are also having more fertility treatments than ever before, and fertility treatments are locally also more effective than have ever been before. For example, in 2022, Canada performed 42,000 IVF cycles, and that's almost double what it was in the last 10 years.
So with that in mind, let's go back to the original question. Why am I not pregnant?
So many factors. We talked about age already. So why is age a big deal? Well, female fertility declines with age, and this happens in 2 ways: decline in egg quality and decline in egg quantity. And unfortunately, there's not a lot that science can do to turn back the clock. Certainly, fertility treatments like IVF can help, but even in IVF, we're still working with the eggs at whatever age they are. So that's why even in IVF, the pregnancy rates are much lower in older reproductive age compared to younger reproductive age. Male fertility actually also decreases with age. And this is a common misconception that it doesn't matter for men how old they are. It does matter. You have increased risk of chromosomal abnormalities in the babies or the embryos. And also there is a decline in sperm performance with age. The big difference is that it happens much later than it does for women. So for women, the end of the fertility window is around 40 to 43 years of age. And for men, we start seeing a decline in sperm parameters after 50 years of age.
Very different, yeah. Men and women, are they equal? That's the eternal question.
Oh, don't get me started on that.
Yeah, that's going to be for another episode.
I can go on a tangent there.
Oh, yeah. Generally speaking, another reason why couples might be having difficulties conceiving is that there can be hormonal imbalances. And hormonal imbalances is a really, really broad term. And it can mean many, many different things, but it can be things like, probably most common is PCOS or polycystic ovarian syndrome, where we see that women will have irregular menstrual cycles and they may not be ovulating once a month. And that will also decrease the chances of fertility. You could also have other kinds of hormonal concerns, like let's say it could be something with your thyroid. It could be also something with the hormones that are coming from the brain that speak to the ovaries as well. And a lot of these things can be kind of figured out through blood tests.
Another issue that could be preventing you from getting pregnant is structural abnormalities with the reproductive system. That could be things like blocked fallopian tubes, abnormalities in the shape of the uterus, endometriosis that can cause inflammation in the pelvic area, fibroids or polyps, especially fibroids are located inside the cavity of the uterus. For men, structural issues of the reproductive system can look like varicoceles. Varicoceles are swollen veins in the scrotum that allow for increased temperature in the scrotum and therefore increased motility and increased abnormal morphology in the sperm.
Another big area is nutrition and weight. When we're talking about weight, we're talking about really kind of extreme fluctuations in weight here. So, for instance, somebody who has undergone bariatric surgery and they go through that first year after the surgery, they lose a lot of weight really rapidly. And we know that causes a lot of big physiologic shifts and changes. And so that can actually decrease fertility rates. And often it's actually not recommended to get pregnant the first year after bariatric surgery. On the other end, women who have very low BMIs. So the classic example is always the very fit female, right, that they talk about in the med school textbooks. Remember that?
Mhm.
So women who have very low body fat percentages, we're talking competitive gymnasts, competitive dancers, or ballet dancers, another big one, where their periods may actually stop as well. It's really those two extremes of weight where we can sometimes see changes in physiology, changes in hormones that can lead to difficulties conceiving. So it's not just obesity, it's also being underweight as well can have negative effects.
Absolutely. Another important factor, which is talked about enough, I think, is smoking and substance abuse. Smoking is way less common than it used to be for very good reasons. The impact of smoking on egg quality is so significant. And of course, we always hear about people that smoke and do drugs and, they have multiple children. And of course, that happens.
Totally.
But certainly, if you are struggling with infertility already, certainly adding the smoking and the drug use is a big problem. So marijuana is now legal and that's fine, but there is an impact on egg quality with marijuana use. We'll do a whole podcast on it for both egg and sperm. And it can also impact the developing fetus as well. So certainly marijuana, smoking, alcohol, one glass of wine here and there is fine, but significant amounts of alcohol use can also have a detrimental impact on both egg and sperm quality.
Another one that I'd mention is vaping.
Yes.
Because I found a lot less people are smoking. When I ask that question, they don't often mention the vaping because vaping kind of has this reputation of being safe or okay. Did you ever see that?
Yeah, I've seen it. Yeah.
Yeah. So now I always ask specifically about smoking and vaping. But again, same concept. It still can really, really affect egg quality, egg reserve, and the quality of the sperm for sure.
That's true. And there are other toxins also other than smoking and alcohol and marijuana use. So I think we're also going to have a whole podcast on this because there's a lot of research there as well. But it's worth looking into sort of your daily products, the nail polish that you use, the shampoos that you're using, the cosmetics that you're using, switching over to glass instead of plastic, because environmental toxins can also have an impact on fertility rate.
Probably one of the biggest things that I get asked about will also be about stress and the role of stress and fertility.
Yeah.
This is a tricky one. And the reason I say it is because infertility in and of itself can lead to so much stress. Even just trying to conceive in general can lead to so much stress and anxiety. We've all heard the story about, the person who gets told like, oh, just relax and it'll happen, or just go on vacation and it'll happen.
That is so annoying.
That's the worst. We would never say that for the record. Okay. That's not what we're saying. What I always tell people is like, there's always so many stressors in life. And yes, when you have stress, it does affect the hormones in your body. And that may in turn affect fertility, also even just your ability to try and conceive. I mean, having intercourse and all that stuff, for instance. I think the big focus, though, is not about reducing stress. I always tell people, think about how you're processing stress and how you're dealing with stress and how you're coping with stress, because stress is unavoidable.
That's right.
If you're not stressed about one thing, you're going to be stressed about fertility or your work or family or whatever. It's really about managing stress and learning to cope with stress through things like therapy, cognitive behavioral therapy, exercise. Yeah, that's a big one for sure too. And so that's something I talk to people about.
Absolutely. I think you're right. That's probably one of the most common questions that we get asked. And I struggle to answer it because the last thing that I want is for women to be stressed about being stressed.
Yes.
And to be blamed about their stress that they're having because they want this so badly.
Yes.
And hey, I've been there. I've struggled with infertility myself for years. That could be a topic for another podcast. And I know what it's like. And there is nothing worse than being so stressed and being told because of the stress that you can't get pregnant. I mean, I could punch somebody in the face every time I heard that.
Boxing would be a great way to relieve stress.
That's right. So that is certainly not what we're saying here. But that's not to say that you shouldn't be looking at your stress levels and that you shouldn't be doing everything that you can to try to make your life, for lack of a better word, less stressful. And that might look like looking at your jobs, your relationships, maybe not even fertility per se, but the people in your life. I know when I was going through it, I made sure that I didn't have the energy for relationships that weren't serving me. And I didn't go to all the baby showers, and I didn't go to all the things that I normally go to because I've had like a lower bandwidth. I was struggling with infertility. So, I had a lot stronger boundaries then than I have now because I feel now stronger and healthy and I can deal with all of those things. So that would be one example where we're not saying stress is the cause of your infertility, but please do look at it.
Yeah.
And protect your mental health. Do all the things. Therapy, I'm a big proponent of therapy. It helped me a lot when I was going through infertility, whether it's therapy or coaching or group therapy. Journaling is a big one for me as well in terms of releasing my stress. And then, like Dr. Weiss was saying, movement, exercise.
Yeah.
I know the last thing you want to do when you're stressed sometimes is exercise, but you'll be surprised how much it can help.
Yeah.
So certainly invest in your mental health. Fertility journey could be very long. You don't know that. And the sooner that you learn your coping strategies and the sooner that you learn to protect yourself and your mental health, the better you will be. But it's not a simple relax and you'll be pregnant. That's not what we're saying.
Oh, God, no. I really hope someone's writing down all these podcast ideas for the future. Another reason why somebody may be having difficulty conceiving is chronic illness. So we know that people who have certain medical conditions, things like diabetes, whether it's type 1 or type 2 diabetes, thyroid issues, autoimmune diseases, all of these things can affect fertility as well, again, by affecting hormones and hormonal regulation. And not only that, but they can also affect the health of the person in pregnancy too. So if you're trying to get pregnant and you have chronic medical issues, it's a great idea to talk to your family doctor, your fertility doctor about, okay, when I get pregnant, how are we going to manage this? What's the plan? What are we going to do? And how is this going to impact the pregnant self so that you can prepare as well?
Absolutely. And speaking of chronic conditions, medical treatments as well sometimes can cause fertility issues. And I'm specifically referring to things like chemotherapy or radiation for cancer, which is why it's really important if you're going through this. And I know being diagnosed with cancer, it's really hard in and on itself. But if you're having a diagnosis and you're thinking about fertility, talk to a fertility specialist about freezing your eggs. That's something that in Ontario can be covered with the Ontario funded program. And also if you're having any surgery in the pelvic organs, especially even if it's not cancer surgery, but if it is any surgery involving the pelvic organs, like the ovaries, that would be another important conversation to have with a fertility specialist prior to undergoing the surgery or the medical treatment.
Anytime anybody has surgery in any part of the body, there's always a risk of scarring. And when you have scarring in the pelvis, it can affect the ability of the uterus, the ovaries, the fallopian tubes to move freely in the way that they need to. And then the big one, of course, is surgery on the ovaries. So anytime you have surgery done on the ovaries, even if you have like the best surgeon in the world, there's always a risk of affecting the eggs in the ovaries and decreasing egg reserve in the ovaries as well.
Absolutely. And the last one is inherited conditions. So genetic factors can have an impact on fertility issues. For example, there could be abnormalities of the Y chromosome with males causing low sperm count. There could be abnormalities in the X chromosome with females, like Turner syndrome, also causing issues with ovarian reserve. This could be another factor as to why you're not getting pregnant. And again, a fertility specialist can help determine that.
I think it's also really important to point out that any couple can have a combination of all of these different factors. It's pretty rare that's ever just one thing.
Absolutely. And another thing to point out is we've said a lot of things here, but many times some of these diagnoses get revealed as you go into the journey. Like, for example, a karyotype, which is a way to find out if there is a genetic abnormality, is not something that we would order like right off the bat, or HIPAA won't let us cover it. It's extremely expensive privately. And it probably wouldn't be a high yield to spend $800 on a couple that has been struggling with infertility for a year with no recurrent miscarriages and no other clues in the medical history that there could be a genetic condition. That doesn't mean that you cannot identify a genetic condition down the line, but in medicine, physicians are always trying to optimize the ratio of treatment, costs, and investigations to success. So every time we order a test, we want to say, okay, what is the cost of the test financially? What is the medical risk of the test to the patient? and what is the yield what is the chances that the test is going to give us information that is going to change your treatment. So a lot of the things that we talked about here may not be obvious at the onset, and it doesn't mean that your doctor wasn't thorough, that your doctor didn't do all the testing. So we don't want this podcast to be like, these are all the things that you need to test for. Some of the things can't really be uncovered as you go through the journey and different things come up.
So to kind of go back to the question of why am I not pregnant? Probably the most common answer is, we don't know exactly, but we're going to work really hard to try and figure out why. But more importantly, just because we don't know the exact reason doesn't mean we can't get you to the big goal, which is a healthy pregnancy. Because at the end of the day, having a diagnosis is nice for people, but that's not why you're seeing us. You're seeing us because you want a healthy pregnancy, and that is truly the primary goal. And even if we don't know exactly why, it doesn't mean that we can't help you get to where you want to go, right?
That's right.
And sometimes we never figure it out.
No, and the path to parenthood is not always straightforward. I mean, sometimes it is, and we love those cases. But the majority of the time it isn't. You can do IUI number 1, number 2, number 3, IVF. There are different things that can come up with IVF. You may need to do it again. So it's not always straightforward. And we know, because we've been doing this for a long time, and we develop close connections and close relationship to our patients, that there is a huge emotional weight of infertility, and it can be very overwhelming.
We really just want to let you guys know that your feelings are valid and that your journey is truly uniquely yours. And the emotional weight of infertility, as I said, can really be overwhelming. And it's okay to feel a mix of emotions: sadness, frustration, anger, moments of hope, moments where you just want to laugh or cry or both.
And both. Whenever people ask me, who are you most inspired by? I always say my patients, because really our patients are the bravest, most courageous people I know. The kind of things that they go through and the kind of things that they do, the courage that it takes to show up again and again, even when the success is not guaranteed, is really incredible.
Absolutely. And, I think that as fertility specialists, I always think of myself as the person who's going to walk beside you on your journey. And we're that listening ear, we're that shoulder to lean on, always ready for a hug too.
Absolutely. None of this is easy, but we're here for you. We hope that this podcast becomes a cherished resource for you. We are going to be here every Tuesday to share a fertility topic, and we're excited to do this. I hope that you found this useful.
And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast, or visit us online at myconfertility.com. And don't forget, follow, subscribe, and share your favorite episodes.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss. Music from Mix Kit Raising Me Higher by Ajay Stelino. My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.